Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, associations of horseshoe kidney. Okay, in horseshoe kidney, okay, in horseshoe kidney, you will see that there is in horseshoe kidney cardiovascular system abnormalities are seen, like ventricular septal defect, and central nervous system involvement is also seen. Anorectal anomalies or malformations are common in horseshoe kidneys, and also unicornuate or bicornuate uterus can be seen, with renal abnormalities which are vesicoureteric reflex or pelviureteric junction obstruction can be seen in one third of the cases, and the patient might have hypospadias or undescended testis is also seen in many of the cases. So these are the associated abnormalities in horseshoe kidney. Then on clinical features, you will see that there is the most of the patients are asymptomatic, and this horseshoe kidney is mostly an autopsy finding which is seen, whereas the most common symptom in horseshoe kidney is presence of the abdominal pain, and that abdominal pain is vague abdominal pain is seen. Then we have Rawlings sign. In Rawlings sign, if the patient tries to hyperextend the spine like this, by bending backwards, if the patient tries to hyperextend the spine, okay, in this case of hyperextension of the spine, the patient will have abdominal pain and also nausea and vomiting, mainly on the hyperextension of the spine. So this is called as Rawlings sign, which is seen in renal horseshoe kidney.
thank you and thank you for watching.